Welcome to another episode of The Disruptors, where we're arming you with the tools you need to innovate within the physical therapy space by highlighting those who have come before you. I'm your host, Stephen Cohen. Now, let's get into it. Welcome back to another episode of The Disruptors, where we're highlighting innovators within the physical therapy industry and helping make innovation feel just a little bit more accessible to you on each and every episode. Today, I am blessed to be joined by Daniel Sage of Hands-On Diagnostics and so much more as he and I have got to know each other. But I want to pass it over to you, Daniel, to do a quick intro before we get into it.
Yeah, thanks for having me, Stephen. And again, Daniel Sage from Hands-On Diagnostics. I'm a physical therapist. I was in private practice for 30 years in South Florida. We implemented diagnostic testing, and you speak of innovation and cutting edge and forward thinking and pioneering things. We were Hands-On Diagnostics' first client in 2013. We put EMG studies, nerve conduction studies, musculoskeletal ultrasound in our practice in 2013. And at that time, we did it just to elevate our company, our clinics, what we were doing professionally, really sophisticate our ability to make a physical therapy diagnosis with much more accurate testing. And it was a game changer for us for 10 years. And then I sold the company. But from an innovative standpoint, Hands-On Diagnostics, they were doing diagnostics for their own practice since the 90s. I mean, and not many PT practices were doing that stuff. Yeah. And they brought it to the market in 2013. And I think at that time, they did a research study, 3% of physical therapists in private practice knew that they could actually even perform diagnostic testing. Nobody knew about it.
Yeah.
And then when I found out about it, I looked into it, checked our Practice Act, checked the Medicare language, and sure enough, yeah. So it was an awesome journey for me, and I sold the company, and now I'm just paying it back and helping them out.
That's so cool. I'd say when we first started really marketing on the remote therapeutic monitoring RTM side, I think that 3% may have held too in Q1 of 2022. Luckily, it doesn't hold quite that low today, but still is not nearly as high as it should be. But that's not what we're here to talk about. So, Daniel, you're a physical therapist, right? Started your own practice. What got you into physical therapy? Like, why did you decide to go down that path?
Yeah. I mean, look, I think like so many PTs say, and, it's like the passion of helping others, of changing lives. I mean, honestly, my undergrad was in cardiac rehab. I would have went to med school, but then I had the opportunity to go into physical therapy, and I had a vision of always opening my own practice. So 2 years out after I graduated, I opened up my own practice. And I felt I was operating with a certain amount of autonomy and decision-making that I can decide how I want to treat patients, what do I want to do with patients, how do I want to affect their lives. If I didn't have that opportunity, I would have went to med school, because I just had that mindset that no one can treat a patient as good as me. And that's not being cocky. It's just being confident that I love what I do. I'm passionate about how I help people. I didn't want someone to tell me how to do what I, wanted to do. So, I went into private practice and stumbled into something, and it was really an awesome ride for close to 30 years.
That's so cool. So, I think it'd be really there's two pieces. I think I'm going to go actually like closer in the past, and then maybe back a little bit further. So. You brought on Hands Diagnostics in 2013, right? Walk me through the decision-making process for you, right? So, as others that are listening might be considering more innovative tools and approaches, what was your decision-making process? What did you need to hear? I would love to get like a peek into your mind during that decision-making process.
Yep. So when I found out about it, the first thing after I did my due diligence that we can do it, yes, was what purpose is this going to serve for my practice? What is this going to do for my patients? What is it going to do for my staff? So, I took a hard look at the sensitivities. When I do an evaluation on someone's neck and I do a special test called a Sperling's test, it's 30% accurate. So I can do that differential that test call it something based on performing that test and miss it 70% of the time. So there could be cases where we're treating somebody with what we think is one thing, but it's actually another. So it had to check the box off from what is it going to do in terms of delivering better results for my patients? Well, the idea is an EMG nerve conduction study is almost 85%, 88% accurate. So it raises the level and accuracy in calling something what it is, makes sense. Then I can guide my treatments based on what I found. That's cutting edge. It doesn't happen in our field. And it felt right for me in 2013 because I did my thesis in PT school on autonomy in physical therapy, because autonomy is an important aspect that defines a profession. There's certain things that define a profession, backed by science, research-based, and autonomy is one of those things. So I really felt it would raise the level and sophistication of my physical therapist. It would really help us practice with autonomy, more effective treatment plans, better outcomes, no brainer, really no brainer. So that was the impetus and the push of why we did it. And it positioned me much more different than my competitors, not even close. And so really, Stephen, honestly, that was the reason. The secondary effect was reimbursements were about $500-$600 an hour.
That makes it make sense, right?
I mean, it does, but I tell everybody, I never make a decision because of money. Because if I make a decision because of money, it's never enough. You want more and more money. But when the decision is backed by purpose, if it fuels what we're trying to do in our clinics, if it does something for our patients, and what I did for my staff, I took therapists that were making 60, 70, whatever back then, $70,000 a year. We pay a board certified person $120 a year. I changed their careers.
Yeah.
And it feels good. So that was the thought process behind it. And what I didn't realize 9 years later, when I decided to sell the company, what it did for my exit, for the profit margins, we didn't have declining reimbursements in 2013. It was still pretty good.
So I want to focus on one piece there because I think I want to make sure I'm right on this. So from Jump Street for you back in school, you really wanted to figure out how to practice as autonomously as possible, right? So that was your drive, and now you had a passion behind that. And hands-on diagnostics gave you that pathway in a very real way that made sure, and we'll get to it checked with the box in terms of lenses you would make a decision on, right? But I think it's really important for people to hear that you had a passion, which if we boil it down to like even almost like a more primal, right? Like you wanted to practice autonomously.
Yeah.
And then from there it was, okay, well, how do I make it in my control to do that? And this was the optimal way to make that happen. Like I think that is, first of all, is my sort of like boiling of that down correct?
I mean, it is. The other thing that was really important to me in practice was not only taking care of my patients, but taking care of my staff. I mean, my staff was very, very important to me. And as practice owners, it's like one day you go to work and the next day a therapist sends you an email and says, here's my 2-week resignation. And like, oh, here we go again. I got to jump back in patient care. I got to drive to that clinic. So I always had the mindset, what can I do more for my staff? How can I, take care of them better and better? And from a financial standpoint, well, if we're doing diagnostics, we're bringing in $500 an hour, and I can generate $500,000 more a year. I can take care of my staff. I can have more effective, sustainable bonus programs, which we did, and I could pay a therapist. The APTA data in July of 2023, a therapist who's trained in electrodiagnostics under the APTA makes $70,000 more a year than any other PT.
Holy cow.
Yeah, and a PT that's like orthopedic OCS, orthopedic certified specialist, they make $8,000 more a year. But someone in diagnostics makes $70,000 more a year. So
that is wild. Yeah.
So I'm able to offer that to PTs that when they take a job from me, never knew that they can now, for free, join an APT approved, American Board of Physical Therapy Specialty approved residency program. I just changed your career.
That's amazing. And there's two pieces that I want to make sure to highlight there. And one is let your passion drive where you want to innovate, right?
Yeah.
And I think you absolutely did that. And whether someone's passion is on practicing autonomously, I definitely hear the taking care of your staff and feel very, very strongly about that on our side as well. But right, maybe your passion, right, if you're listening, is not that, right? It's I really want to own the patient reported outcomes. Like, or I want to look at recidivism. Like, wherever your passion is, let that drive you into where you want to innovate. And if you do that, it's going to be able to help you. As I would imagine, you had a roller coaster, right? Which ups and downs, but hopefully trending like up and to the right, and it helps buoy you right in those tougher days. That is just a wild delta from 8 to 70. I mean, that's crazy.
Yeah. And PTs, not many know. Like when I talk to owners now, and every owner, every private practice owner today, their pain points are declining reimbursements, working harder and harder in the business, right? Retaining staff. So, and I'm a firm believer that, practice owners, the business should be working for them. In order for me to be the dream maker, in order for me to enjoy what I do, to continue to open up practices in this town, in that town, the business has to work for me. If I'm working for it, I become a slave to it. I can't create on it. I can't build on it. And if I can't create and scale it, I can't help as many people as I want. So I'm a firm believer that, sometimes practice owners, they get stuck in that one lane. So if we're talking about innovation and taking that leap of faith, well, sometimes it requires coming out of that comfort zone, out of that lane that we know, to figure out what do we need to do. And it might be a little uncomfortable because we've never done it before, but we got to do something different. Otherwise, year after year, we're getting cut more and more in our reimbursements. And it's not okay. It's really not okay, because I believe in the private practice PT. I believe in what we do, but we can't do the same thing and expect a different result, especially in the next couple of years. And the last 5 years, Medicare's conversion factor cut 10.3%.
Yep. Yeah.
It's real.
I know we've been at a couple breakthrough events together, right? And the graph that Chad Madden always throws up, where you could see that the conversion factor is less today than it was in 1994. It's just like, it's a very sobering and infuriating chart to look at. But that's real. And I couldn't agree with you more. As you implement it, so obviously you led with patients and then the patient outcomes. Yeah. And I will say that's been our experience as we talk to practice owners across the nation. No matter if it's a single, owner operator, all the way up to, hey, we have 5,000 clinicians. It does need to be outcomes led for it even to get exciting for folks. And I don't think it's that way in every other medical industry or vertical, however you want to describe it, right? Or profession. And that's something that makes me really proud to be in the PT space, is like that is of utmost importance. And so you talked a little bit about that decision-making process to move forward, but I'd love to take actually like the next layer of the onion there, right? So what was the framework you used? You're like, okay, we're going to look at outcomes, then staff, then business. Like how, or was it more of like, we're going to weight these things? Like, how did you build that decision framework to figure out what you're going to move forward with?
Well, the thing is, and I will speak to that too, is like, as PTs, we're all about outcomes. We're all about taking care of patients, doing the right thing, and really sometimes a little excessively, but it is what it is. But I can tell you this: we did in hands-on diagnostics, we did a research study in 2020. We took 462 patients that all had an EMG, nerve conduction, and ultrasound performed. 61% of those patients the therapist had to change the treatment plan because they were treating something that they didn't know about that they found out on a diagnostic test. 61% of the time. So if you talk about outcomes and raising the bar, my God, we've had cases over the years. Podiatrist sends a patient to us for plantar fasciitis, pain in the bottom of the foot. We're treating it, not getting any better. Well, before diagnostics, the patient either one would self-discharge and say, well, they didn't help me. 2, go back to the doctor and say, they didn't help me. Doctor sends them somewhere else. 3, doctor does an injection, medication, other things to try and figure it out. But after diagnostics, we actually did a lumbar EMG on the patient, and it revealed the patient had a bulging disc. It was nothing to do with the foot. So you treat the back, the foot gets better. Or we had cases where you think it's coming from the neck. We do an EMG, the scalenes, the muscles outside are pushing on the nerves out here, treat the soft tissue, symptoms get better. So from an outcome perspective, there's nothing like it. There's nothing a physical therapist can do in an evaluation that will substitute 80, 90% accuracy in advanced diagnostic testing that we provide.
Well, what you're talking about is a not even titration of care is a terrible phrase. Must strike that one from the record, right? But like you're being, I mean, let's call it surgical, right? Like it's hey, this is exactly where we need to go, and we have an extremely high level of confidence there to be able to do that. And I'd have to imagine that and I'm definitely going to get over my skis, and then you're going to help with some data that I'm sure you have, right? I'd have to imagine, especially for your newer grad PTs, like, holy cow, right? Like, this has got to be huge. And of course, I'm not saying that it doesn't help the more, the veterans out there, but gosh, I mean, when I think of my own career, right? Like, all these, the new grads now have like, generative AI for Excel, and we had, not that, right? Like I got to think in my non-clinical, I'm just trying to come up with a, something similar, but gosh, like maybe I'll just stop there and then let you talk.
Well, I know what you're going with, and there's that article that the APTA put out in July of 23, and they compared salaries. They also talked about the ideal therapist that really significantly makes a big splash is someone out 3 to 5 years that's now going into diagnostics. Because they're just going to change their career for the next 15, 20 years. And I talk to owners now, and I'll tell an owner, look, what's your goal? Well, I want to exit and sell my company in the next 5 years. Fair enough. Let's put diagnostics in your practice for all the right reasons professionally. Yep. I can easily slam that in. But if I'm an owner, and I was, and and the only reason why I'm with hands-on diagnostics is because when I retired from my company, I spoke to Dimmy, our owner. He's like, look, come work with us. Come help practice. I said, great, 'cause I can't sit around doing nothing. But my passion about it is I watched what it did for my practice. I did not know when I put diagnostics that 9 years later, I'd be looking at declining reimbursements that didn't really affect me as much as bringing in so much money in diagnostics, that when I sold my company, I got a significant multiple and a great EBITDA because of that. So now when I talk to owners, and if their goal is the next 5 years exit, well, I can tell you right now, if you take an owner today, they do nothing differently in 5 years, based on the trends of reimbursement, the value of their practice is going to go down.
Yep.
And owners will say to me, well, we're going to offset that with more volume. Got it. We can work on our better percent arrival. People are arriving to the clinic. We can try to renegotiate contracts, which are all important things. But it's not going to make near the splash of EBITDA and profit margin increase of putting diagnostic testing in, where these guys are making $400, $500, $600 an hour. Not even close. And they're willing to work harder and harder to generate more volume when they're getting reimbursed less and less. So the owner, I tell the owner, look, if your goal is 5 years, don't get trained in diagnostics yourself. Take a PT that's in your practice 3, 4, 5 years out. Set their career off for the next 15, 20 years. You're going to change their lives. They're going to change your practice. they're going to commit to your practice because it's one of the things that they have to commit to the practice if we're paying for their residency. But as an owner, I just changed the value of my practice probably 20 to 30% and my multiple times a couple. And I just took a PT that's 3, 4, 5 years out, and I just changed their lives.
Thank you for listening to this episode. This would not be possible without the sponsorship of Sarah Health. Sarah is the relationship operating system for physical therapy practices, driving better patient outcomes, improved arrival rate, and improved financial margins. If you'd like to learn more, check them out at Sarah, SARAhealth.com, SarahHealth.com. And if you'd be interested in advertising with us and helping us produce even more great stories, please let us know at Steven@SarahHealth.com. Now, back to the episode.
Right, as you raise your EBITDA percentage, right, your multiple goes up, and also like if you're raising the percentage, that means also the the actual number itself is going up, right? And it really is like, oh well, instead of at 200,000 EBITDA, right, getting a 4x multiple, now at 250, because that percentage is so much better and the business is so much more efficient, you're getting a 5 or 6x multiple, which means you're like, that's fun math. That is fun math.
Yeah. And the thing is, I never knew that. See, when I put diagnostics in, my mindset was, what am I doing for patients, my staff? Yes, I'm raising my profits, but I was making great money then too. So what the necessity level of fighting declining reimbursements was not near as what it is today. So fast forward, when I sold a company, I'm like, I got to help practices because this is not fair. And I talk to owners all the time. And we signed up a practice. She's 69 years old. She just signed up with us about a month ago because her practice isn't worth anything anymore. And the only way she's going to sell is to raise the profits. She's not doing that with straight reimbursements, what's happening in the market. So she put in diagnostics. I spoke to this other guy in Long Island. He's been in practice 40 years and he still works 60 hours a week because he can't afford to hire more staff. So we'll put diagnostics in, he'll train in it. He'll make $400 or $500 an hour. Now he can afford someone else, let them do the PT work. Now he's not working like a slave into it, treating 20 people a day, 60 hours a week. He's able to step back and do something much more higher level. And the other thing I want to mention is from an innovative standpoint, PTs are now able to play in the sandbox that only neurologists and physiatrists have been doing. They're generally the caregivers for, the providers for EMG, ultrasound, nerve conduction studies. But now a PT can do what a physician's doing. Game changer.
Oh, I love that. And in a few other episodes, we've talked about that a PT is more than just a physical therapist, right? Like more than just a movement health professional, right? There's especially as we talk about another like behavioral change, right? Like PTs have some of the best, if not, I'd go as far as say the best skill set to affect behavior change in a patient, right? Like you're getting people that have never exercised before to exercise. You're getting people to be able to rethink the way that their body moves. You're getting them to rethink habits. Like all of that happens within that, 10 visit, however many visits, right?
Yep.
30 to an hour with that patient. And it's because a real relationship gets driven and as a result. And I love this idea of facilitating a more accurate plan of care based on the diagnostics. And even if even if you did have fewer visits per episode, like your self-referral rate is going to be through the roof. People are going to know that you're being extremely judicious with their resources, right? So your self-referral rate is going to go through the roof. You are going to have great word of mouth and referrals from other patients. And gosh, I got to imagine even your referral sources at the MD level are going to get even more excited as well. Like, okay, well, I know if I send them to Daniel, then the likelihood that they come back to me with a similar issue, the recidivism goes way down.
That's exactly right.
It's a very like there's just so many ripples, right, to that positive ripple effect. From there,
we as we really penetrated the community what we decided to do is we let our physicians know that we had a residency in diagnostics. At first, therapists like, oh, am I going to annoy a doctor because they do diagnostics or they do EMGs? Okay, so if a neurologist is my referral source and he knows that we're doing EMGs, we respect and we don't do EMGs on his patients if that's what he wants.
Yeah.
But we have physiatrists that send diagnostic referrals to us. We have huge orthopedic groups that send diagnostic referrals to us pre and post surgery to see the health of the nerves and so forth. So the exciting thing as a PT practice, we became a referral source. Like a doctor writes a prescription to go to this MRI facility, they're sending patients to our PT place for an EMG and not the neurologist. And why? The quality of our reporting is significant. Neurologists, sometimes they have the nurse that does the nerve portion. They come in, they drop the needle, they're in, they're out. They do EMGs once a week because they're doing a million other things.
Yeah.
But our PTs, this is what they do. So the quality of the test is amazing. We turn around results within 24 to 48 hours. Our referral sources value that, sent and just started sending people to us just for diagnostics. And even before I retired, the guy, Sean, who's training, orthopedic calls him up. Hey, Sean, got this case, blah, blah, blah. I'm doing surgery in 2 weeks. I'm going to send him to you. I want you to do the EMG, do this, do that. And then Sean would call the doctor up with the results. They'd go over it together and guide the doctor in terms of his surgery. I mean, what PT is having that communication with a surgeon? They're not. That's autonomy in PT. That's raising the game. And I can tell you this, you're right. PTs, the greatest PTs, know how to connect with the patient, motivate them, reach them emotionally, touch them mentally. I got all that. But if I can do all that, plus I'm going down the right lane because I've got accurate diagnostics, I just hit a grand slam. And you're right. Doctors loved it. They saw the value. Patients in that research study we did as well, I forgot to mention, 90% of the patients felt more engaged. They felt more understanding of their problem because they're watching their PT evaluate their shoulder, doing an ultrasound and showing them the tendon and the inflammation and what they're working on. The trust factor is significant.
There's a couple of things that come to mind, but absolutely right. You put it in like layman's terms, right, for the patient, right? Like, oh, okay, that thing isn't supposed to do that, right? Like, I mean, and I'm not a clinician. Gosh, the last like biology or anatomy class I took was in freshman year of high school. So
It's all right.
physics was easier for me, so I went that route during undergrad. But like that can make a lot of sense, and when I just get put into my own terms on the value of it. Right. One of the things I do in my training is we do velocity based training. So we know how fast the bar is moving at different points of the lift. And like, that is exactly like, oh, what do we need to work on? Like, it's not okay, well, let's try working on a, deficit pull for 4 weeks. Like, well, your problem isn't from your, the lift off to your knees. It's really from your knees to your hip. So we're just going to like overload your quads for the next 4 weeks. Like, it's targeted, right? And people, they don't want to be in pain for any longer than they have to be. And so the value prop is as a patient just makes so much sense. So much sense. I do want to come back to you and ask a question I really like asking. And I'm going to put you on the spot. So I don't think I'm going to give you the heads up on it. If you had a magic wand and could fix one thing within physical therapy, what would you fix?
The reimbursement model is horrible. The absolute is horrible. It's unconceivable. That's the right word. It's inconceivable to think that in the last 5 years, reimbursements are going down. The value of us from an insurance carrier's perspective is less and less. Medicare and in private practice that don't do a lot of Medicare, oh, I don't do a lot. So yeah, but you know what? Most payers eventually follow the trends of what the federal government is doing. And Medicare just cut the PT evaluation code 3.4%, I think, this year. The most sacred code to the physical therapist is not manual therapy, Therax, balance training. It's the evaluation. It's where the PT is putting their thinking cap on, determining what's wrong, and coming up with a treatment plan. Well, guess what? Our government says it's worth less and less. And it's not right. We're the ones that are keeping people out of hospitals, away from medications, injections. We are, holistic practitioners changing lives and people, keeping them healthy and living longer. Why are we getting valued less and less? So the reimbursement model is horrible. And let's face it, every PT, every private practice PT that has a purpose and a passion, in order for me to scale that and to facilitate that, I need money.
Yep.
Money is a form of energy that allows me to fulfill a purpose. And if I don't have that, I'm strapped, I'm stressed, I'm anxious, I can't take care of patients, I can't take care of staff, but we're getting reimbursed less and less. So really what that says is, what's going to happen to the private practice owner in the next 12 months, 24 months, 36 months? Why should a private practice owner be busting their butt for all these years, taking all this risk on, managing staffs of 30, 40, 50, 100 people, and the value of the practice is getting less?
Yeah.
It doesn't make any sense.
No.
That's it.
I hear you say reimbursement, but what I think I hear as almost like an undercurrent to that is the value, the understanding of the value of physical therapy. And if I'm hearing that correctly, I would agree with that, in that a similar analogy that we as a society, we love our firefighters, right? But we don't give a lot of love to the people that put in the fire alarm. And I think very similarly, physical therapists have so much impact in helping people to avoid way more expensive, bigger levels of treatment, right? And
Yeah.
so they create all this value. And I don't actually think there's a lot of people that say, oh, I don't believe they're creating value. It's just, gosh, it's a terrible job of proving it and figuring out ways to extract the value back that they're creating.
Yeah, our lobby too. The problem is we don't have a strong lobby, at the federal level, and that's unfortunate. The AMA obviously is the strongest. Chiropractors have a pretty strong lobby. Ours is not the strongest, so we just get stepped on, and we get looked at as like personal trainers, and we're not. It's like I used to work in brain injury before I went into private practice. Well, treating someone post-stroke, that's extremely technical stuff. But I'm still the same PT then as I am in my private practice, and my thought process and my critical thinking is the same. It just happens to be with a shoulder, a hip, a knee, balance issues and things like that. But we're just getting devalued year after year. So my purpose and passion now is to let private practice owners know you don't have to sit and take it, and you can work on certain things that'll help. But if you really want to elevate what you're doing professionally, if you want to innovate what you're doing in terms of operating your practice, how you're treating patients, wouldn't you want to play in a sandbox of neurologists and physiatrists? Wouldn't you like to have CPT codes at your disposal that are making you $400 or $500 an hour? You deserve that. We deserve that. Why? The other thing is this. I'll tell you this. I promise you, half these EMGs and nerve studies neurologists do. What they probably do with the result? They say, this is what it shows. Take this medication.
Yep.
So what we do is we say, here's what the results are. Now we are going to do certain neuromobilization techniques based on those results, because we teach practices how to perform certain neuromobilizations based on the results of an EMG nerve study. So now we teach practitioners how to implement a treatment based on the results of an EMG and actually do something different. Boy, that's really using a diagnostic test for a clinical utility value versus what a neurologist does. That's innovative.
Well, and then you got to talk about the pharmaceutical route, right? And it's not cheap. It's not cheap to go pick up that, like, no matter where it stands in your formulary for your payer, right? And all of a sudden it's like, oh, do I want to pay $75 a week for medicine, or gosh, I have a $40 copay for PT, right? Like which one do I want to go down? And sometimes it can be that easy, right, for patients. But unless you're even like setting it up for that to be possible,
Yeah.
then that opportunity isn't there for the patient, and then they don't have the agency like we've talked about prior. Like you really, again, you're giving them agency over their own body,
Oh
right?
yeah.
Like, here's the information. Let me help make you an empowered patient person, and let me show you that our bodies are incredibly resilient. They're malleable in the best way, and they will heal if taken down the right path.
Taking down the right path. Yeah. You take that example of a podiatrist, patient, oh, you have plantar fasciitis, take this medication, maybe they do an injection. I don't know what they do medically, then go to therapy. Now we're wasting all these healthcare dollars treating something that is not that I discover on an EMG. That's
Yep.
perfect. That's the way we should operate. I mean, throughout
Yeah.
the years, and when we were doing diagnostic, instead of my evaluating PTs, it's like it's almost malpractice. If a patient's coming in with some kind of referred pain, radiating pain, numbness, tingling, weakness, it's almost malpractice if I don't perform that test because what if it's something else? So what we would do is we communicated with our doctors. Once they knew that we had a residency program, they were like, "Really?" They start sending their own patients to us, and then we also went into doctors' offices. I could put a trained therapist in a doctor's, and we put diagnostic testing in a doctor's office. So the doctor now has his own in-house diagnostics for
Yep.
his own patients. He doesn't send them to a neurologist. He's now an informed decision maker because he gets the results of a diagnostic test and says, "Oh, you know what? The nerve's not that bad. You don't need a surgeon. Go to therapy. Or it's bad. You don't need therapy. Go to this guy." So they
Yep.
become more informed when they make a referral. And by the way, they're billing and collecting $400 or $500 an hour, paying us cash at $250 an hour. So the doctor's making a spread of $300 an hour for what I provided him. I'm paying a PT $60, $70 an hour. I make $100, and everybody wins.
Yep.
It's a no brainer.
I I love that, and based on what you're telling me, I would have to completely agree. And it's when it's what we shoot for at Sarah as well. Like there are enough things that are taking money out of PT's pockets.
Right.
We are not one of them, and will never be one of them. And making it a no brainer, right? Like especially, I think for what hands-on diagnostics provides is like not only yes the reimbursement and the better outcomes, but also like as a PT, I gotta imagine you hear quite a bit like you're giving me agency back for my career, right? And like, like I mean, that and that mindset shift.
I mean, look, even like when you and I spoke from what you guys do at Sarah Health, we spoke. What was it like? You can make like 3, 4, $5 more a visit. Was that what we were talking
like
about?
5 or 6 is about the average that we see.
Yeah, I mean, I'll tell you what, and I think I mentioned to you that our partnership dropped Humana nationwide.
Yep.
I'll tell you what, if we were able to make $5 more a visit, maybe they wouldn't have done that. And in terms of what you guys do with patient engagement, so again, same thing. What's the purpose? Well, better patient engagement between the therapist and the patient, where it's a value-added service. Oh, and on top of it, I can make $5 more a visit. Okay, let's go. I mean, it makes perfect sense.
Yeah, but I think a theme that is run through this conversation is you really do, as you think about any sort of innovation within this space, you do have to think of it in more than just one lens, right? You need to think, okay, what are the patient outcomes? What is my impact to staff, right? You can split that into clinical, non-clinical, and then what is the impact of the practice? But I think you do it in that order, and you
Yep.
end up in a really good spot at the end. And for us, like, okay, the outcomes have to be better. Let's go prove it. And so we did a study to be able to see, like, okay, what happens? Like, oh, all right, the patients on Sarah got to a 14-point better functional outcome based on the photo score than the control group. Okay, that's great. They did 2.3 fewer visits. Okay, well, that's fantastic. And a $47 per episode margin increase for the
Bingo.
practice. Like,
Yeah.
bing, bing, bing. Like, how often do you want to play this game?
Yeah.
And that's, it seems like you have done that similar framework of patients, staff, practice, made sure it works across all three, but you go through it in that way. and you really end up with something that's valuable to everybody. And then it doesn't become a flavor of the week thing. It's like, oh, no, this is just part of our DNA now.
It's what we do. Yeah.
Yeah.
Well, I think too, also because we put remote therapeutic monitoring, when I was in practice, that you guys do, because we need to scrape every penny. We need to figure out how are we increasing value,
Yep.
and is it good for the patient? But I can tell you this: there are practices and owners that don't do something like that, or they don't look at diagnostics because they're complacent. They want to stay in their lane. They don't want to disrupt something. Oh, it's another thing. I'm working on an EMR now. Now's not the right time. I'll tell you what. When it is the right time? When you're at the bottom of the ladder? When you're completely on your back? No, because complacency equals death. If you're not expanding and changing, forward thinking, you're shrinking. And things like what you're doing, what we're doing, practice owners, it's a must. Because
Yeah.
if you think you're going to do the same thing and trying to renegotiate contracts, okay, maybe, I know cases where the insurance carrier pays a little bit more this year, and guess what? Next year, they take it all back. They cut it. They did it with my buddy's practice in Buffalo. They gave him like a 25% increase. A year later, they got rid of it. That's, those kinds of things, we're putting control in the hands of the insurance carrier.
Yep.
Okay. And I get that they're paying us, but the more that I diversify in Sarah Health, hands-on diagnostics, it fits the right model. Why? It's better outcomes, better patient care, increased reimbursement, no brainer. So
Yep.
the owners today, the ones that are innovating, forward thinking outside the box, willing to take a chance, are going to be the ones that flourish and prosper. And the ones that aren't are going to be the ones that are slaves to their practice and have no freedom of time and no freedom of money.
Oh,
we have
freedom of time. That is a magic. That's such a good phrase to use too, Daniel. I appreciate you saying that particular, right? And I think it reminds me of a quote from a book I'm reading right now called Arete by Brian Johnson, which I suggest to everybody. It's fantastic. Is an ounce of discomfort today is immensely, immensely better to swallow than a pound of regret tomorrow.
exactly.
And that ounce turns into a pound. Probably turns into a ton, right? And just don't let that happen.
Yep.
Don't let that happen.
Yep. That's so true. It's very true.
Well, I know we're about up on time, Daniel. This has been a fantastic conversation. So
Yeah, I
I'm
appreciate
not
it,
surprised based on how fun our conversations have been
Yeah.
in person. If you could leave our folks with, as you think back to, I think put yourself back in your shoes in 2013 of like, okay, we need to do something different, and I need to innovate in some way. What advice would you have either A, given yourself now that you've been all the way through it, or B, even, what would you say you did right? Like what mindset, just a piece of advice for our listeners.
I believed in myself. I believed in taking risks. I was passionate. I'm still passionate about what I have to give. I believe that I can make things go right. I believe that I can expand my business. I believe that taking calculated risk and feeling nervous about it and a little worried is okay, because I believed in me. I believed in what I could do. So for the practice owners that are out there, you just got to, you got to grant yourself acknowledge that it's okay to feel concerned. Oh, if I do this, what if? But the more that we sit back and take a passive role, we're going to get crushed. So being able to take calculated risk that makes sense, but believe in yourself and taking good risk that is healthy for the business is a good thing. So it's being complacent and staying in the lane, that is not good, because it just introverts the owner. They get stuck in the practice. Taking calculated risk, believing in who you are, and having the resources around you, go for it.
I'm going to say something. I'd be curious to see if you would agree with the summary. What do you want to be you want to be absolutely perfect and great at dying, or you just want to be good at growing?
Yep. Oh,
I'd rather be good at growing.
no question about it. Yep. Oh yeah. No question about it. And that's my passion now. I'm going to continue to communicate with practice owners, help them to the best of my ability, but really help them think that it's okay to take a chance. It's okay to take some risk. If it makes sense, you'll be successful. Go for it. Go for it.
Absolutely. Absolutely. Well, Daniel, thank you so much for the time
Yeah, man.
today. I really appreciate it. I think that you've given some really tactical pieces of advice to our folks, which is always the goal, to make innovation, one little bit iota more accessible. And I think you've achieved that in spades today.
Awesome.
So with that, thank you very much for joining me. I appreciate it.
Pleasure. Thanks, Stephen. Talk to you soon, bud.
Thank you for listening to another episode of The Disruptors. I hope that you were able to take one or two things away that you can apply immediately to your own innovation journey. As always, I'm your host, Stephen Cohen. This is sponsored by Sarah Health. Let's keep moving.